Good evening. Welcome to Community Crossfire, another point of view with your host, Norman Oliver. Norman's not here tonight, and I'm Gary Hutt. I'll be your host for at least the next half an hour. Norman's away on family business and asked me to host this first half an hour for him. As you all know, Norman likes to bring useful information to you, news that you can use, if so to speak. And that's exactly what we're going to do tonight. Now, a lot of you are hearing information about the Affordable Care Act, and that's basically what we're going to be talking about for this first half an hour. For the last 6 or 7 months, I've been working with the Smalls Insurance Agency, and Fred Smalls asked me to come in with him come in there because he understood that beginning January of 2014, everybody is going to have health insurance. He wanted to have somebody in his office who could specialize in that area and work with his customers, his personal lines customers, as well as his commercial customers, to help walk them through this maze. One of the folks that I've worked with during that process is a guy by the name of Nick Morello, and Nick is the president and CEO of Health Insurance Associates. Health Insurance Associates has been around doing health insurance exclusively for about 40 years. Nick is the president and CEO. He hasn't been there for 40 years. When they put the camera on him, you'll see that Nick couldn't have been there for 40 years, but he's a good guy, and he's been doing a lot of work with the Affordable Care Act. A lot of you folks know that, as I said, January 1, everybody's going to have health insurance. And what we want to do is just spend a little bit of time explaining to you what that is, what it means to you, what you have to do, what some of you won't have to do anything. Many of you won't have to do anything. And we're going to help you understand the difference. So I'd like to just kind of introduce Nick. Nick, why don't you just spend a couple minutes just kind of talking about yourself and what you've been doing with Health Insurance Associates, and how you got involved with the business and how you became president and CEO.
Sure. Thank you. Thank you for having me tonight. So yeah, our agency, Health Insurance Associates, we do exclusively health insurance, and we're the largest in the Delaware region by quite a bit. And we handle Delaware, Pennsylvania, and Maryland, helping specifically small business owners to provide health insurance benefits for their employees, individuals to provide health insurance for a variety of reasons, folks that need to purchase coverage on their own because they're self-employed, or because they've retired before the age of Medicare, or perhaps they work at a small employer with no health insurance coverage. And we also do a lot of work with older adults and Medicare. Mm-hmm. And so those are the things that we do. And as you mentioned, this is shockingly to me my 20th year in the business now, so been plugging away at it for quite a while. And through those years and our connections, we've been pretty involved with helping to implement the Affordable Care Act, right, specifically here in Delaware.
Right. So let's start from the very beginning.
Sure.
Let's just what is the Affordable Care Act? I know some people call it Obamacare, but the actual name of the act is the Affordable Care Act.
Exactly. It's the Patient Protection and Affordable Care Act.
Okay.
So a lot of acronyms involved. Some folks call it PPACA, or ACA, or Obamacare, or simply healthcare reform. But it was a piece of legislation that passed in March of 2010, and the goal of the legislation was to make sure that all Americans have a certain level of health insurance coverage, and that it was affordable coverage for them. Right. So that was the goal of the bill. And much of the bill is coming to light specifically this year as we move into 2014.
Right.
So many of the components of the bill are just really coming to the forefront now as we approach the fall.
Now, one of the things folks need to understand that effective January 1, 2014, everybody under the law will have to have health insurance. Is that correct?
That is correct, yes. So all Americans come January 1st will need to have health insurance coverage, and the coverage that they carry will need to meet minimum federal guidelines
Right.
of coverage. So there's a bar that's set, and all policies that folks have to be at least as good as that bar.
Right.
Now, some folks may have it through their employer,
Right.
but if they don't, other folks are going to have to pick up coverage on their own.
So now, beginning October 1st, however, is when open enrollment for this entire process begins. That's right?
Yeah, that's
so
correct.
Beginning October 1st, people can start enrolling into a health insurance plan. Whether those folks who are not currently covered under a plan, or who are currently not in a plan that meets the requirements.
That's right.
Right.
So one of the new pieces of the Affordable Care Act is this environment for health insurance called a marketplace.
Right.
And some folks have been referring to it as an exchange.
Right.
So this marketplace exchange opens on October 1st, and it'll be open enrollment through October 1st through March 31st.
Right.
And during that window of time, folks can purchase health insurance coverage, and the plans that they're going to be looking at will be governmentally standardized, and they'll have metallic names, bronze, silver, gold, and platinum. But no longer will insurance companies be permitted to ask a person about their health history or anything that folks might have had as a pre-existing health condition.
And that's an extremely important feature of the Act, that up until now, health insurance companies could say, well, if you have a pre-existing condition, diabetes or some other kind of pre-existing condition, they could deny you coverage or charge you an extra premium for it.
Sure. Every day, that's one of the biggest challenges that we face in our industry is folks that are seeking out coverage, and they have the dollars and the means to purchase insurance, but when we're evaluating their health history, they have certain conditions
Right.
that's made it hard for them to obtain coverage. And that'll be a practice that goes away for next year.
And there's some other benefits that are already in place. For example, many folks who have health insurance with their employer or elsewhere, many of those folks have dependents that are under 26, and the Affordable Care Act, one of those features of the Affordable Care Act is already in place, in that those folks that have kids that are up to age 26 now can be covered under that. Can you talk about that?
Yeah, that's correct. So a couple pieces of the law have already gone into effect this year and in prior years since the passage of the law in 2010.
Right.
And a big piece is that parents can keep their dependent children on their plan until the age of 26, and no longer is it relevant if the child is a student.
Right.
It's basically you can stay on until the end of the month when you turn 26. There was also a lot of preventative care benefits that have been mandated onto insurance policies, things like free preventative screenings, wellness visits, things of that nature. And insurance policies can no longer have limits on the coverage for essential health benefits.
And that's a big change as well, because at one time, if you as an individual went out and purchased insurance in the marketplace, there was normally a situation where there was a lifetime cap on those policies, and that's been eliminated.
Correct.
Right.
Correct.
Listen, Abin, that's my office number that you have up on the screen, because one of the things that you can do, you can call myself, you can certainly call Nick. If you have additional questions about what you need to do, feel free, and I'm gonna make sure that Nick, you give your number before we wrap up today. That's my number at the bottom of the screen. But what we're going to do now is ask Abin to flash the studio number across the bottom of the screen, if you would, because we are going to take telephone calls.
Sure.
One of the things that folks may not understand is now, the Affordable Care folks that have been out there up to now trying to purchase health insurance on their own have learned that health insurance is not necessarily all that cheap.
Sure.
And it can be a little bit expensive.
Yep.
So, it's not unusual to spend $300 or $400 or even more per month on health insurance. Well, if the government is requiring me to purchase health insurance if I don't have it, are they going to do anything to help me out in terms of that premium? Or?
Yeah, absolutely. So one of the big things is insurance is already expensive now, today.
Right.
And we're concerned that as insurance companies can no longer ask folks about their health, and policies can't have limits, and they'll cover more things than today, there's a lot of fear that pricing is going to go up next year, and maybe considerably.
Right.
But to your question, there's some assistance for folks next year.
Right.
So one of the pieces is there's always been state Medicaid.
Right.
And so if folks fall under the federal poverty level, they'll be able to gain an insurance plan from their state. And then the new twist for next year is for folks that have anywhere between 1 and 4 times the federal poverty level, they'll have the availability of tax credits and subsidies.
Now, so let's make that, let's restate that in real words. 400% of the poverty level for a family of 4 could be up to close to $90,000.
Exactly correct.
So there's a huge subsidy, a huge range of people that would be eligible for a subsidy. So
yes,
if you have if you're making a little bit more than say that income that would make you eligible for Medicaid and kicks you out of the Medicaid pool and forces you in the other pool, there still is some help from the government for that.
that's exactly correct.
Right. We got calls coming in. Let's go
Okay.
to the phone for just a second.
Sure.
Take a couple calls and then we're going to go to a quick break. Hi, you're on the air.
Hello.
Hello.
Yes. Is the young lady there that is doing the sickle cell?
No, she's not, but we're going to be going to a sickle cell commercial shortly, but she isn't here right now.
Oh,
Okay.
because there's been 2 other associations for sickle cell disease. She's
Okay.
not the first.
Okay, thank you.
You're welcome. What time are you going to the next commercial?
Oh, in a couple minutes. Thank you.
Okay, Sickle Cell Disease Association of Delaware, that was started in 2001 with the help of Senator Carper, Representative Mike Castle, and at the time, Senator Joe Biden.
Okay, thank
and
you.
the United States Treasury. You're very welcome.
Thank you for the
And
clarification.
tell her I said congratulations. I'm glad someone picked it up.
Yeah, she's doing a wonderful job too. Thank you.
That's wonderful.
No. Okay. All right. Thanks. Well, why don't we go to that commercial right now? And because my dear friend Dr. Nina Anderson is doing a wonderful job with the sickle cell march and walk and run. I'm going to walk. I'm not going to run. But certainly encouraging everybody to get out there and support this worthy event. So, Abner, if we can cue up that sickle cell commercial, let's go to the commercial. And welcome back. I'm Gary Hutt, your host for this evening's Community Crossfire, Another Point of View. And I'm sitting in for your regular host, Norman Oliver, who is away on family business today. And again, I want to thank you all back, and we have our guest this evening, Nick Morello, who has been working rather extensively in the area of the Affordable Care Act and trying to bring you information about how that's going to impact on you, become effective January 1. Now, unfortunately, it just in my mind, Nick, I haven't seen a ton of information out there. So I think that there's been a concern on my part that there are a lot of folks that are going to be affected by this program that may not know, and that's one of the reasons why we're doing the show. What's been your experience? Are you starting to get more interest?
Yeah, we're getting more and more calls every day
Right.
from consumers and small business owners who want to know how this is going to affect them.
Right.
And a lot of the questions that folks have really aren't answered yet because most of the questions revolve around cost.
Right.
And we just don't know,
We don't know.
unfortunately.
Let's go to another call.
Sure.
Good evening. You're on the air. Hello.
Yes, how you doing, Gary?
Hey, Mr. Julius.
Yes, this is Julius Cephas. What I'm calling you about is that if he was talking about the insurance reaches a bar, now if certain people have insurance, if it doesn't reach the government's bar, what happens then?
That's an excellent question.
Sure. So his question is, what happens if somebody doesn't have insurance, or if they have insurance,
And it's
but it's
inadequate.
not at that minimum
Right.
level?
Right.
And there are penalties in that situation. So currently, the penalty for 2014 for an individual would be either $95 or 1% of the person's income as a tax penalty when they file their personal income tax.
And those penalties escalate in subsequent years, do they not?
They do, that's right, and they're subject to change. So we're concerned that they may escalate quickly.
Right. Now, if I'm a small employer, now there was and I've had this question from a number of people who own their own business. Folks were under the impression that the president has kind of pushed back the requirement for businesses, for certain businesses. Who are those businesses?
Yeah, so if I could give a few more details there. Businesses, for purposes of the Affordable Care Act, are going to fall into two categories based on their size. So there's basically small and large.
Right.
And small would be businesses that employ fewer than 50 full-time people, and businesses that have more than 50 full-time people.
Right.
So in that small business arena, there's not many requirements for them under the Affordable Care Act. They're
Right.
not required to offer coverage, but they are required to notify their employees before October 1st about the availability of those marketplace exchanges that we talked about.
Right.
In the above 50 world, employers are required to offer coverage beginning in 2014 if they're not already, and the coverage they offer has to meet that minimum floor.
Right.
And the part that they charge employees has to be less than 9.5% of their income. Otherwise, there's penalties to the employer. But what got postponed is the penalties to the employer now don't happen until 2015. The requirement's still there in 2014, but the penalties don't happen until 2015.
So if I work for a company, a mid-sized company that does not have 50 employees, say my company has 10 employees,
Sure.
does my employer have a requirement to?
No. And you personally still have a requirement to cover yourself.
I personally still do have the requirement.
That's right.
Right. Yeah, and I think there's been a real confusion about that, because there's still
Sure.
a lot of people out there that just don't understand that whether or not they have to have coverage, and if they do, how do they get that coverage, and whether or not their employers have to provide them with coverage.
Exactly.
So, yeah.
And the big piece to take away is everybody needs coverage next year.
Everybody has to have coverage. Well, listen, Nick, I really appreciate you. I mean, I appreciate your time coming in.
No problem.
And
Thank you
helping
for
us
having me.
explain this to folks. There's going to be another segment with Mr. Alex Coppage and Twin Brown coming up in a few minutes. But I want to thank you all for tuning in for this time. Also, I want to take a few minutes to thank you all for your outpouring of love and support for me and my family during a difficult time as in the loss of my mother. Your support is and keeping my family lifted up in prayer has been a lot to my family, and I certainly didn't want to get off the air tonight without expressing that. A lot of good things were said about my mom at her funeral, and we certainly, as a family, we certainly appreciate that. One of the things that I think a lot of folks may or may not have known, but we knew it as our children. A lot of folks, Mayor Seals, former Mayor Seals, my dear cousin Barbara Shepard, my aunt Novella Brown, Art Boswell, who was really good to see, who I had not seen in a long time. A lot of those folks said a lot of really good things about my mom. But one of the things I don't think they may or may not have understood is that even though my mom did a lot of things for a lot of people and meant a lot of things to a lot of different people in the community, we as her kids, we never felt like she was making a choice between her work, whether it was at the People's Settlement or Head Start Follow Through, excuse me, and her family. We never came second. We were always still, even though her work was very important to her, we always came first, and there were 7 of us. My mom had time for all of us. We'll miss her dearly, and I want to thank you all again for your tremendous support for my family. Then we're going to take a break and we're going to bring on the next segment. Thank you.
Florida, and because I was a DJ and I had all kinds of names, so I was looking to lose my job, the little job I had, because it wasn't working. So I had to come up with a strategy. So they had a one-channel station in Newark where they had a country western program. The rules of the government that they had to have one program a week in order to stay on the air. So I asked them to let me put a local program on. I'm losing my job. I've done everything. The preachers was preaching from the pulpit that we don't need no cable. Nobody needs cable. So I was like I lost out in the wilderness, not knowing where to go. I hadn't been up from Florida but a few years, so I wasn't planted in the community. So I was out there. So I had to come up with some way. So I asked them to let me start a local program on TV. So I did, and along with partnership with a white gentleman named Crawford. He would handle the churches, the white churches, I would handle the black churches. That's why I started. It was free. If you had something that was worthwhile going on, we would let you go on. We would do all the church announcements free. Sometimes we would do 50 announcements on Sunday through the course of the day and all of that. So after a few years, it got popular. We would bring groups in from Philadelphia, which I was familiar with WDAS up there, and we would bring them in from Washington. And finally, the local people start subscribing to cable. One getting cable, others would gather in the homes and look at it. And after about 5 years, they stopped subscribing. After 8 years, we had begun to get sponsors. So the cable company decided we would change from public to lease access and let people buy their time.
Now let's take a second real quick. And now so people can understand really the difference between public and leased access. We're on channel 28. What is channel 28?
This is leased access, a commercial channel which is owned and controlled by the cable company.
Okay.
PEG is a group of entities that's set up by the government, the federal government, that citizens all over the United States would have free access to the airwaves.
Now, when you say, people from all, across the United States, or even more locally, people in Wilmington or in Newcastle County or in Delaware, anywhere, so people can, like you and me, have access to possibly creating a TV show that would be broadcast.
Yes.
And that's the difference. And that's different from channel 28 currently, where people have to buy time.
Buy time.
Okay.
And you can buy the time as long as you don't disobey the federal rules of cursing or something like that, then you do what you wanted. You can jump up backwards against the wall and knock yourself out and get up and keep talking and go on as long as you're paying for the time. But the PEGs have rules, the education and all have rules, the government. But the city only agreed to activate the government channel for all of these years. Now, what's missing with the
Now, for those that don't know, the government channel is WITN channel 22.
22, that's the government channel, which mostly airs the government business, city council, and what goes on, and selected things from the community. Every once in a while, it's selected. For years, all the years that I have been involved with this, I've always cried out the need for an education and a public channel. Recently, within the last few years, Norm Griffin, the former president of City Council, agreed to put the education channel up for bid. Councilwoman Hanitha Sabaz and I have been worrying him for years trying to get this done. She followed through to it, so they did, and Red Clay accepted the bid, and the city of Wilmington contracted with Red Clay. Now they have 965 on the air. That's been
And what channel is that?
965,
965,
Comcast
so
965.
People can go to channel 965 and you can see programming that's put on. Is it by students? Is it by
Well, it's in the building process now.
Okay.
I was in Baltimore for the past couple of years doing the workshops for the Baltimore City public and educational channel. And the job is to make sure that those who are submitting DVDs submit them properly, the proper quality and all of that. Red Clay, Patty Nash, who is the public relation person for the Red Clay School District, who actually runs the town, asked me to meet with her concerning of conducting the workshops to make sure that the community get involved with the educational channel. One of the things that need to be known here, that the contract with Red Clay and the city of Wilmington to conduct these services on 965 have some stipulations in it that have to be met. One of the stipulations, although Red Clay have the contract, but they have to involve all the other school districts. They have to make sure that all the other school districts have access, and the public of Wilmington and Newcastle County. Mm-hmm. So that's where the role that I'm playing, CCC is playing, as conducting the workshops to make sure that the public understand how they can access. Now, it's an educational channel, so they are not open solely to community programming. But because of not having a public channel, they have agreed to accept some educational-oriented programs to mix in with the educational program. So that's the role that we are playing with the workshop. Now, what we have going, I have 6 producers who are in the video production business who have joined me in helping to produce programs to go on the channel. For an example, if People Settlement wanted to put a promo on about what programs they offer at People Settlement, we would put that promo together and we can run it on the educational channel where the people in the community will know what programs are available at People Settlement, Hicks Anderson, Kingwood, or things of that nature. You have civic organizations who have different meetings and different things to discuss. Those are the kind of educational-oriented programs that will go. You have groups out there that's producing programs every day. That's good quality programs. They cannot afford to pay for it to go on 28 lease access, but it will qualify to go on the educational program. So, but what is wrong with the new contract that's coming up?
Well, let me hold you right there. We're going to take a quick break. I know this is a little bit complex for most people to understand, you know, leased access, public access. The bottom line is, people out there, if you're watching, if you ever have a desire to be a celebrity on TV or have a voice to share, you need to listen to Twin B because he's advocating on your behalf. But let's just take a quick break. We'll be right back. Welcome back to Community Crossfire. I'm Alexandria Coppage, sitting in for Mr. Norman Oliver. We are still here with Twin B, and just to give you a little more background on who this man is, why he's so important, he was one of the integral, critical pieces to creating Channel 28. I mean, a channel that is a landmark in especially the African American community, but especially Newcastle County in general, just a channel that people go to for insight on what's going on in their community, to advocate or raise awareness for a particular cause or an issue. Even Community Crossfire. So many people tune into this program, and you are, at the leading force that spearheaded this whole thing that made it possible. So I just want people to understand your significance to television and our community.
Yes. Going back to this morning, I came down at the last minute to do the 9 o'clock hour. And quite natural, I was ready to do it because I had this information, and every opportunity I get. While on the air, my cell phone was ringing, and I had to go to Philadelphia and do some other things. And I didn't get a chance to check my messages until late this afternoon. And I received 40-some calls thanking me for explaining for the last 2 or 3 weeks the concept of what cable companies demanded to do and have to do for communities. In the areas around us, Philadelphia, Washington, Baltimore, Virginia, all of those communities are receiving benefits from this. I'm not only talking about the PEG and the channel, they put monies into the community centers to help to promote positive programming. The only reason that Washington and Newcastle County have not received those funds is they have not asked for them. Mr. Pritchett and I, when he was at Bancroft School before he retired, we took a group up to Pennsylvania and spent the day going around into the counties of Pennsylvania, viewing the different education and public channels up there. The last 2 years I worked down in Baltimore, and I invite anyone to go down and spend some hours in Baltimore and get in a place where you can view the channel. Now the mayor, your boss and my good friend, I did many interviews with him when we talked about the importance of the education in the public channel. He have a daughter, I believe, that lives in the Washington area, and I have tapes where he had talked about he went down there, and he was amazed to see the involvement not only of the young people in the community, but the parents in the community participating. So this is why it's been my cry for 40-some years to try to get the education and the public channel activated in Wilmington and Newcastle County. So now, since the new agreement with the turning over of the channel 28, instead of being one channel on that 28, it's going to be 3 different entities on there. I don't see any way where anybody in their right mind can verify doing that, because the prime time on 28 is already occupied by the people who are on 28 now. When the new contract come out, those people will still have their same slots. So if you put the public channel on there, it's going to be on the back side in time that's not prime time. Now here's the catch to it. The federal government setting up PEG, it was set up where the public would have equal access to the airwaves. So if the public channel is on the back side of 28, there is no prime time left there. They will not have equal time to lease access. I'm for lease access. I started it all. I'm glad that a way was found for it to continue. But lease access only benefit a small segment of the community.
People who can afford it.
People who can afford it. It's always been that way. But we have gotten so locked into lease access because it's all we had. But it wasn't all was available for us. We could not get the city council, the mayor, nobody to do it. Now, I did talk to Tom Gordon years ago when he was in office before his transition about this, and he was interested in it. And I understand now he's interested in getting their franchise agreement for the county. The county can have their franchise agreement just like the city have theirs. They can have their PEG just like the city can have their PEG. So it's so important for the community to know. Now, I was told at a meeting a few weeks, Tuesdays ago, that they have to go through with this because it was inherited from the former city administration. I don't believe that because anything that's not finalized can be changed, can be altered. It haven't been finalized yet. The TPO is still out. The decision haven't been made there yet. So pulling the public out, putting it on the channel by itself will have no effect on the continuation of lease access.
Now, I'm going to play devil's advocate on you really quickly. How do you decide who would be able to be on public access? Because with lease access, it's based on whether you can afford it if you want to spend the money to buy airtime. So that automatically weeds out the majority of people. So for public access, if Miss Betty and, you know, Mr. John and anybody else, Mary, Becky, and Sue all want to show, who then decides who gets to be on public access?
You would have a director, somebody in control of it. You would have an advisory board and all of that. You would have a process where the DVDs or the tapes will be submitted. They will be carefully gone over, carefully evaluated and all that. It will be a system of qualification. It won't just be anybody can present it. You would have to put some time in the production. In Baltimore, all of the tapes that come in from individuals, you have individuals who are putting tapes together. As long as they meet the qualifications, then they can go on. This is all over the nation a big thing. This is how you eliminate crime, making young people get involved into things that they can feel good about themselves. And in 2007, I was able to get those young people to get down to business and study their different scripts to put together the documentary on August Quarterly because they was looking forward to seeing themselves on TV and on DVD. They wanted to feel good about themselves. So this is what we are faced with in Wilmington. You can talk about more police officers, you can talk about anything of that nature, but until we offer some positive alternatives that can change the attitude and the behavior of our young kids and our young parents. We got to deal with both the young kids and the young parents at the same time. It's working in other places.
Okay, well, we got more to talk about the benefits of public access, why, you know, people should get involved with public access, and afterwards, going forward, if they feel called and moved by your they do. How can they, you know, champion your cause and hop on your back and try to, you know, get us some public access? But let's take a quick break. We'll be right back. Welcome back to Community Crossfire. I am Alexandria Coppage, and I am here with Mr. Twinby, the founder, creator of Channel 28 that we all know and love. And just really quickly, if you can, how can people get involved with advocating for more public access television?
Well, there are several ways you can do it. We'll be pushing, and I'm going to be talking with you further. I'm going to be talking to my good friend and your boss, Mayor Williams, who over the years have really created interest in the PEG system. The workshop has been established now to promote the educational channel, which is on 965. The workshops are being held at the William Hicks Anderson Community Center from 5 to 7 every afternoon. If there are anybody who have a DVD that they think qualified, they can bring it by. We will work with them on it. And if the agencies who would like to get material on the educational channel, that's what we are there for. We have 4 producers that's working with us to help us to do this, to make sure the community get involved. Remember the key, Red Clay have the contract, but they are obligated to get all the other school districts and the community involved. So this, if they have further information, they can call 287-4413.
Thank you so much, Twinby. We really appreciate having you on here. Thank you for all our viewers out there. We really appreciate you hanging with our visitor, our co-host today, Alexandria Coppage, myself, and Mr. Gary Hutt. I know you guys will be looking forward to having Norman return next week. Enjoy your holiday weekend. Take care, be safe. Thanks very much. This is Community Crossfire.